Pioneers of brain stimulation, José Manuel Rodriguez Delgado and Giovanni Aldini. Welcome to our exploration of two fascinating scientists who pushed the boundaries of neuroscience and electricity, José Manuel Rodriguez Delgado and Giovanni Aldini. While controversial, these pioneers conducted groundbreaking experiments that significantly advanced our understanding of the human brain and the effects of electrical stimulation. José Manuel Rodriguez Delgado was born in Spain in 1915. He earned his medical degree and doctorate in physiology from the Universidad Central in Madrid before moving to Yale University in 1946. At Yale, he worked as a fellow in the laboratory of John Fulton, a renowned neurophysiologist. Delgado's most significant invention was the Stimulation, a device that allowed two-way communication with the brain. This implanted electrode could both stimulate different brain regions and record brain activity in mobile subjects. This technological breakthrough opened up new possibilities for understanding brain function and behavior. One of Delgado's most famous experiments involved implanting stimulatives in bulls. In a dramatic demonstration, he showed how he could stop a charging bull by activating the implant with a remote control. This experiment captured the world's attention and demonstrated the potential power of brain stimulation. Delgado extended his research to human subjects, particularly patients with chronic refractory epilepsy and schizophrenia. His work in this area was published in 1952, coinciding with the early days of psychopharmacology. While Delgado's work was groundbreaking, it also sparked ethical debates. He positioned his research between the growing disapproval of invasive brain surgery and the limitations of oral medications. His vision of using electrical stimulation to treat mental disorders was both revolutionary and controversial. Giovanni Aldini was born in Bologna, Italy in 1762. He graduated in physics from the University of Bologna in 1782 and later became a professor of experimental physics at the same institution in 1798. Aldini was the nephew and assistant of Luigi Galvani, who discovered animal electricity. Aldini participated in crucial experiments with frog muscles that led to the idea of electricity as a vital force flowing from the brain to muscles. Aldini used Alessandro Volta's bimetallic pile, an early form of battery, to apply electric current to the bodies of animals and humans. These experiments, which he conducted throughout Europe, were often spectacular public demonstrations. One of Aldini's most famous demonstrations took place in London in 1803. He applied electrical stimulation to the body of George Forster, an executed criminal. The experiment caused the corpse's muscles to twitch and contort, creating the illusion of reanimation. Aldini's experiments had a profound impact on his contemporaries and may have influenced Mary Shelley's Frankenstein. His work also laid the groundwork for various forms of electrotherapy used in the 19th century. Both José Manuel Rodriguez Delgado and Giovanni Aldini were pioneers in their fields, pushing the boundaries of science and our understanding of the human body and brain. Their work, while often controversial, paved the way for modern neuroscience and electrotherapy techniques. As we continue to explore the frontiers of brain science, we owe much to these early innovators who dared to imagine new possibilities for understanding and manipulating the human mind. Aldini developed early forms of transcranial electric stimulation, which involved applying electrical currents to the scalp to modulate brain activity. This non-invasive approach is a precursor to modern techniques like transcranial direct current stimulation (TDCS), used in treating various neurological and psychiatric disorders. Aldini used galvanism to treat patients with personality disorders and reported complete rehabilitation following transcranial administration of electric current. His work in treating mental illnesses such as schizophrenia and chronic depression using electrical stimulation paved the way for modern electroconvulsive therapy and other brain stimulation techniques. Aldini's experiments with electrical stimulation of the brain and body laid the groundwork for the development of deep brain stimulation, a procedure currently used to treat motor and behavioral disorders. Aldini's research contributed to the development of various forms of electrotherapy that were widely used in the 19th century and continue to influence modern therapeutic applications. His experiments demonstrating the effects of electrical stimulation on different regions of the cerebral cortex raised the possibility of using electric energy as a therapeutic tool in humans, advancing our understanding of brain function and its relationship to behavior. This technique, which evolved from Delgado's early experiments, is now FDA approved for treating various neurological disorders. Modern applications include Parkinson's disease, targeting the subthalamic nucleus or globus pallidus internus, dystonia, globus pallidus internus, essential tremor, ventral intermediate nucleus of the thalamus, severe obsessive-compulsive disorder, anterior limb of the internal capsule. Building on Aldini's early work, modern techniques like transcranial direct current stimulation (TDCS) are used to treat neurological and psychiatric disorders. Delgado's stimoceiver concept has evolved into sophisticated brain-computer interfaces, allowing direct communication between the brain and external devices. Both researchers' work has influenced modern approaches to treating mental illnesses. Current research explores DBS for refractory depression, obsessive-compulsive disorder, and other psychiatric conditions. Techniques like repetitive transcranial magnetic stimulation, RTMS, are used to study and modulate brain plasticity, building on the principles of brain stimulation. TMS is used to map brain functions and study phenomena like visual awareness and memory processes. DBS is extensively used for treating severe movement disorders, including status dystonicus and post-stroke hemiballismus. Giovanni Aldini's experiments with electrical stimulation of animal and human bodies in the early 19th century demonstrated that electricity could influence muscles and nerves, laying the groundwork for understanding how electrical currents interact with the nervous system. In the mid-20th century, José Delgado advanced this concept by implanting electrodes in animals and humans to stimulate specific brain regions. His work demonstrated that electrical stimulation could modulate behavior and emotions, introducing DBS as a potential therapeutic tool for neurological and psychiatric conditions. The introduction of stereotactic techniques in the mid-20th century allowed precise targeting of deep brain structures. This shift enabled safer and more effective electrical stimulation, replacing earlier lesional procedures used for Parkinson's disease and other disorders. By the late 20th century, DBS was recognized as a treatment for movement disorders like Parkinson's disease, essential tremor, and dystonia. Alim Louis Benabid's work in the 1980s and 1990s refined DBS, demonstrating its safety and efficacy compared to ablative surgeries. Modern intraoperative imaging allows precise placement of electrodes, improving accuracy and minimizing side effects during DBS implantation. Unlike conventional DBS, constant stimulation, ADBS uses real-time feedback from brain activity, for example local field potentials, to adjust stimulation dynamically. This approach reduces side effects like dyskinesia while maintaining symptom control, particularly in Parkinson's disease. DBS is now used for psychiatric conditions such as obsessive-compulsive disorder, OCD, and depression, as well as epilepsy, Tourette's syndrome, chronic pain, and even minimally conscious states. Advances in programming allow clinicians to tailor DBS settings to individual patients' needs, optimizing therapeutic outcomes while reducing adverse effects. Modern DBS continues to evolve with innovations like closed-loop systems, adaptive DBS, and new targets for stimulation. These advancements build on the foundational principles established by Aldini's galvanism experiments and Delgado's pioneering electrode implants, demonstrating how their early work has shaped contemporary neuroscience and therapeutic techniques. DBS has demonstrated significant efficacy for treatment-resistant OCD. Studies have shown that DBS targeting the anterior limb of the internal capsule can lead to symptom remission rates of 53% after 12 months and 71% at long-term follow-up. Results for DBS in treating severe depression have been mixed. A recent study showed that about 1/3 of participants experienced full remission of symptoms, while half reported a reduction in symptoms 2 years after DBS treatment. However, large controlled clinical trials have shown limited success, indicating that further research is needed to optimize this treatment for depression. DBS is being investigated for conditions such as addiction, anorexia nervosa, and post-traumatic stress disorder, but these applications are still in experimental stages. Despite its potential, DBS has had limited impact in psychiatry compared to its use in neurological disorders. While nearly 300,000 patients with neurological disorders have been treated with DBS in the past 20 years, the number of psychiatric patients treated with DBS worldwide probably does not exceed 500. Different brain regions may improve different aspects of mood-related behaviors, suggesting that precise target selection is crucial for optimal outcomes. Individual variability, patient-specific factors can affect DBS outcomes, highlighting the need for personalized approaches. Long-term effects. Some studies have shown that DBS can provide long-lasting benefits, but more research is needed to confirm these findings across various psychiatric conditions. Delgado developed the Stimulation, a wireless device that used bidirectional radio waves for brain recording and stimulation. In contrast, Aldini used more primitive electrical currents from early batteries to stimulate brain tissue. Delgado conducted experiments on living animals and humans, including patients with epilepsy, schizophrenia, and intractable pain. Aldini primarily worked with animal subjects and human cadavers, famously stimulating the bodies of executed criminals. Delgado's approach allowed for more precise targeting of specific brain regions using implanted electrodes. Aldini's methods were less localized, often involving external application of electricity to the body or brain surface. Delgado's Stimulation enabled long-term, continuous stimulation and recording in freely moving subjects. Aldini's experiments were typically short-term and conducted in controlled settings. Delgado aimed to develop therapeutic applications for neurological and psychiatric disorders, as well as explore potential societal improvements. Aldini's work was more focused on understanding basic brain function and demonstrating the effects of electricity on biological tissue. Delgado's work raised significant ethical debates due to its potential for behavior control. Aldini's experiments, while controversial for their time, did not face the same level of ethical scrutiny. These differences reflect the significant technological and scientific advancements that occurred between Aldini's time in the early 19th century and Delgado's work in the mid-20th century, as well as their distinct research objectives and methodologies.